Thank you everyone very much for joining. Maybe we can start with just a quick introduction from myself and the other two presenters. My name is Vanessa Self. I'm a Regional Food Security and Livelihoods Advisor for Save the Children UK, and I'm also the Asia representative of the Child Poverty Global Theme based in Bangkok, and I work closely with our colleagues in Pakistan. Gufran and Shahid, would you like to just introduce yourselves quickly?
Yeah, this is Gufran Ilai Hashmi from Pakistan, and I'm looking for meal function in Save the Children Pakistan program.
Shahid?
Sorry, it was muted. This is Shahid from Pakistan, working as food security and livelihood specialist in country office.
Thank you. So Kate, if you could go on to slide number 2. So we are very excited to present a cost-benefit analysis of a kitchen gardens intervention, which took place in Shikarpur in Sindh province in Pakistan. The Pakistan Country Office has quite a long history of doing kitchen garden work, particularly since the floods in 2010 as part of the ongoing recovery and then longer term development programming. But I'll just explain a little bit of the context of this specific program. Slide number 3, please, Kate. So it's part of a program called the WINS project. It's the Women and Children's Infant Improve Nutrition in Sindh. It's a 4-year initiative funded by the European Union with the overall objective of improving the nutrition status of children and pregnant lactating women. It's looking both at chronic and acute malnutrition, both of which are quite alarming rates in that part of the country. It's a multi-sectoral program. It has some nutrition-specific and nutrition-sensitive interventions, including CMAM, behaviour change communication, fresh food vouchers for complementary feeding, cash for work, and of course kitchen gardens. So we're looking specifically at the kitchen gardens component, and trying to really understand, well, what does that mean for those sorts of goals? And we're going to be looking at 3 main things. One, the approach that we took to the cost-benefit analysis. Gufran will talk about the method, and it's a very, very simple but very interesting method that can be widely applied to a whole range of interventions, not just kitchen gardening. Then Shahid will talk a bit about the findings and some of the impacts that we uncovered, and then I'll come back and talk a little bit about the conclusions and the lessons. But essentially, we're asking the question, is this the right intervention? What is it? Is it worth the investment that it takes from us as an organisation, and is it worth the work and the effort it takes for the communities and the beneficiaries to keep these gardens going? And it's I think you'll appreciate as you hear the presentation go on that it's done in a very open and self-critical and reflective spirit. So before we begin, a huge kind of congratulations to the country team for being open to such learning and reflection on, and not just sort of doing the same thing again and again, but asking, well, what does this mean for children? So we're going to go through the presentation, and there'll be time for questions and answers at the beginning. So I'll hand over to Gufran.
Yeah, please, next slide. Yeah, thank you so much, Vanessa. Like, before going into this slide, I would like to clarify one important point regarding this cost-benefit analysis. CBA, this cost-benefit analysis are mostly conducted by private sector to know what are the monetary benefits they can get by an investment in certain products. While in our development sector, as we are for non-profit and we did not get any monetary benefits from our investments in communities, however, our investment yields a variety of social return or the social benefits to the communities with whom we are working. So we have approached this cost benefit analysis with this approach that, like, if we are investing in these communities, so what are the social benefits our beneficiaries and our communities with whom we are working, like, they are getting from this one? So we have approached this one with this approach. Now, coming to the methodology, I think if from the you are looking, the topmost thing is the learning agenda. I think this was the project learning agenda that actually helped us to reach and to conduct this cost benefit analysis. Actually, when we were planning this kitchen gardening study, that was already planned, and then there was a one question in our learning agenda, that how is the cost effectiveness of our kitchen gardening. So then we have initiated the kitchen gardening study. We make this question as part of that study. If we don't have that learning agenda in place in the project, so might probably we have missed this very important component about costing. Once we finalize we have a learning agenda, so then our next step was, as per our social return on investment, like our second step was, we really want to identify that what are the key outcomes that our kitchen garden interventions are generating in the project. So for that, like the important point is the stakeholder analysis, like who are the stakeholders and what will be the key benefits, or what will be the key outcome to that one. So in that step, we have identified like these are the beneficiary, these are the market, like, and these are the key benefits to them. And then we have mapped all those outcomes against those important stakeholders. And when we do that one, and then the next step was to collect data from the field. But before collecting that data, I will explain in the next slide. Our next target was that when we identified like these are the outcomes, now our challenge was to basically monetize those outcomes. And for that purpose, we have identified some proxy indicators that I will explain in my next slide. And then we make those proxy indicators as part of our ongoing study of the kitchen gardening. Then we collected in the second step. We go into the field and we collected data of the kitchen gardening and along with the data for this cost benefit analysis. So the important point was that like we did not conduct an exclusive study for the cost benefit analysis, rather that was an ongoing study, and we have just built in that one like this methodology into that one and get the required data in a very cost effective way. And then the third step was the data analysis and monetizing the benefit. In this one, like all the data that we have collected, we have simply analyzed that one in the Excel sheets, and then we analyzed all those variables, those proxy indicators that we have incorporated in this study. Then we have analyzed that for all those sample beneficiaries that we have from these studies. And then finally, when we have all those beneficiaries, then we have finally calculated like if for example, if we have invested $1 in the kitchen gardening, so actually how much that $1 is returning the benefits to the different communities. Next slide. Now this was the first was the learning agenda, and now this was the second step about the outcome mapping and development of the proxy indicator. When we do that outcome mapping with the help of the project team, we identify like beside other benefit, like these were the 5 key outcome of the project like that we can monetize and that we will have from our kitchen gardening. First outcome was the increased income of our target women in the project. Secondly, like when they have increased income, we have also identified like there will be an increased saving from them because now they have available vegetable in their household. Third thing was about the food security, and I will explain how we approach toward food security. And fourth was the women empowerment, and fifth was the improved skill. If you look at the first one, increased income, what was our proxy indicator? Like we thought that first we have to calculate from this study like what will be the total kitchen gardening produced by a single household, and from that total produce, that what was the percentage that actually they have sold in the field. And third thing was what was the average price in the field, what was the average price they get from the market for selling their produce in the market. And similarly, in the same way, we actually in the next slide, Shahid will explain you that what were our averages that we get for that one. And similarly, second benefit was the saving, like proportion of the kitchen produce utilized at the household level, because when they were using the one thing was that they were selling vegetable in the market. Secondly, they were also have the availability of the vegetable in their household, which was basically helping them to have some saving. So we calculated that if there was a if like when they were saving, so what was the actually average price, and what was, and then we monetize that saving into the dollar value, like what could be the possible saving from that one. And thirdly, there was about food security. We have calculated this that what was the food consumption secure, and how was the household which were moving from one category to the other category. For this purpose, we have calculated, like we took the one initially in the project, we have calculated some values about the food consumption score. Then we have about their food score, we compared them with the visiting. And similarly, about the women empowerment, we see that how many women can own their produce, and among them, those who are producing their incomes, those who are owning their produce. So from them, how many actually own their income, and how many of the women basically in that remote area, they have been linked with the market. And fifth was the improved skills, like cost of the learning same skill from, and like we have teach them, now they have improved skills. So if they have not, if for example, if we did not provide them this skill, so what was the actually cost, and what was the, how they can have these from the same area. Next slide, please. Now in the next slide, we will tell you about what was the cost that we have calculated for this project and the benefits. I will start with the cost that we have calculated, and Shahid will explain you about the other benefit that we have. If you look at this slide, basically there are two types of the cost that we have calculated, that we can possibly calculate from this project. One was the cost that was incurred by the households, and secondly, there was the cost that was incurred by Save the Children. If you look at the first cost, we have cost, the labor cost was basically, that was the opportunity cost in terms of paid work. And I did not go into that much analysis, but that basically that was $13.2 per month per beneficiary. And similarly, if you look at those beneficiaries, basically they have to go to the market and they have to sell that project in the market, and that was also a cost. That was a travel cost to sell their produce in the market. And similarly, if you look into the second slide, there are some costs that was incurred by Save the Children. So basically, like the input cost and the training cost, and then there was the HR cost. So these were the three specific costs that we have calculated in this one. But one important point in this was, this was integrated project. So actually, we were not able to know that, like the staff was basically also working in other component of the project. So actually, what was the HR cost, like how much of their cost and how much follow-up visit they have conducted. So we were not able to do that HR cost. Rest of the two costs, like training cost and input cost, we have calculated in this one. So in the final slides, we will explain you that how we have then calculated these costs into the overall benefits. Next slide. Now this is handover to Shahid. From now onwards, Shahid will explain you about the return to the beneficiaries, like what are the returns, or what are the benefits that our beneficiaries get from this investment.
Okay, thank you very much, Hufan, Nisa, and all. This slide showing yield from kitchen gardening per week per household. So yield from kitchen garden per week, most of the population, most of the household, almost more than 70%. Got the yield from 1 to 10 kg per week, and average yield which we perceived on average, that was for 10 kg per week, and that is around about 40 kg per month. 44% of the household were able to sell the surplus in the market, and the average monthly income from the sold produce was roughly $14 per household per month. Next, please. Next slide. This slide showing the consumption of vegetables and saving for the household through this activity. 30% of the households were able to use these homegrown vegetable for 1 to 2 days per week, while 29% used these vegetable domestically for 3 to 4 days a week, and 23% were able to use the produce for the whole week. So 89% of all household members from our target group were able to use these kitchen gardening vegetables at home, which was also one of the objectives to their consumption. 56% consumed produce domestically from their kitchen gardening and did not sell in the market. So they were not having sufficient yield to or surplus yield to sell it in the market, so they consumed it at home. The average household saving because of kitchen gardening was $10 per month, which families were able to save as they were now able to produce these vegetables at home. So this was about household consumption and saving as regards our kitchen study. Next slide, please. Now this slide showing some health outcomes we were able to achieve through our kitchen gardening activity. Groups were there were 3 groups which we considered: one, poor food group, moderate food group, and adequate group. So comparing our study findings to the baseline, 89% were in the poor food group as per our baseline information, and now after the study, after this kitchen gardening intervention, now the 19% were in poor food group. Similarly, in moderate food group, in baseline they were 11%, and after the kitchen gardening intervention, this percentage increased up to 38%. And for the adequate group, there were no household in the adequate group as per our baseline information. But after the kitchen gardening intervention, there were 43% households which were found to be in the adequate group. So, and also comparing the health expenses with the baseline information, it was we found that health expenses incurred by the households were reduced to 23% due to kitchen gardening activity, kitchen gardening intervention exclusively. And as far as this meal frequency was concerned, for children, children in the range of 2 to 17 years of age were having 3 meals per day, which is a normal frequency in our culture that we take 3 times meal per day. So this was also one of the findings, that this kitchen gardening was able to optimize their meal frequency for the day. Next slide. Next slide showing the sustainability of our kitchen gardening interventions. The question was asked that are you practicing kitchen gardening now? So our sample, which also comprised the beneficiaries from 2013, 14, and 15. So the trend showing that 2000 the beneficiary which were benefited with the kitchen gardening package in 2013, 59% of those were still carrying on with this activity, and from the 2014 lot, 65% were still going on with this activity, while in 2015 this figure was 66%, and overall percentage was 64%. Who are carrying out this activity, whether with the support of organization or at their own. So one point to explain here, that as our project is ongoing and follow-ups are continued in the field, so this is most likely that they will continue, and this percentage, high percentage showing here, we hope that they will continue cultivating vegetables at home. But as the follow-ups or the project is closed, we expect that this percentage might go down. I mean, household continuing this kitchen gardening activity at their own may be decreased with the passage of time when we are no more there. So reasons which were asked from the beneficiaries who left this kitchen gardening or didn't show a good result. One was the lack of interest by the household members to conduct this activity, to carry out the kitchen gardening, and few were discouraged by the little yield they got from the kitchen gardening. So they thought that we are not able to get enough yield, so that's why we can't continue. But it also takes time. Few could not afford this activity, both time-wise as well as the financial affordability, because they could not go to purchase the seeds, fertilizers, and the things required for kitchen gardening activity. Also, few thought that this activity has only short-term benefits, so they thought that the long-term beneficial activities were not able to continue. Next slide, please. As far as women empowerment was concerned, that we found that 81% of women in the production of kitchen gardening from our beneficiary lot, but only 37% can decide about the utilization of the income earned through the sale of vegetables. It shows that women, both the women were physically involved and they carry out the practices for this kitchen gardening, but only 37% could decide the utilization of income got from the sale of those vegetables. And only among all the women, only 26% were directly selling the produce in the market and are primary owners of the income they get from the kitchen gardening. And it shows that almost 1/4 of women are having direct access to the markets, so improving access of women to markets and intra-household decision making still remains a challenge. And it can vary, of course, it can vary from culture to culture. We're talking about here in Pakistan. Next slide, please. So now over to Ron. He will expand further returns on investment on this activity.
Yeah, thank you, Shahid. Now, before going into this slide, I would like to explain. Like in the previous slide, if you have noticed, like there were some apparent benefits of the kitchen gardening. You know, if even if they are in terms of, if they were in terms of their increased income, like they were selling in the market, there was improved saving. If you look those benefits, like they were very good. But then there was a question to us when we monetize all those benefits for all those beneficiaries. So we thought that why not, if we can calculate that actually what were the costs that we have made into this project, and we can calculate that what were actually those monetized benefits that we have calculated. So that when we go through that analysis, that has basically presented this picture. If you go to this green slide, basically we have presented 3 scenarios in this slide. In the first slide, there is a scenario where we are saying that all those costs, when the majority of the costs they are beared by Save the Children, so what will be the benefit generated to the beneficiaries? And second is the yellow slide. In that we are presenting, I will explain to that. Like in that we are saying, for example, if Save the Children should not bear all those training costs or follow-up costs and input costs, so then and the beneficiary they have to bear that cost, and what will be the total cost of this intervention, and what will be the benefit of that? And the final slide, the red one, if you that one, this we thought that, for example, we calculate, and because if we can calculate in terms of social returns, basically if Save the Children has invested $1 in this kitchen gardening intervention, so what were the total worth of social benefit that has been generated by this intervention? So if you look at the social benefit, like they look good on shorter term, but when we go into this analysis, we found if you go to this, our main conclusion was that looking at the present cost benefit calculated in this study, if you go to this green slide, this is showing us that return to the beneficiaries, support of the children, like if save the children, like it is total investment is $14, and then the beneficiary will basically get $24 per month to each beneficiary. And if you go to the yellow slide, now the initially beneficiary, they're only investing $14 and they are getting $24. It means this is a profitable to the beneficiary when Save the Children is bearing that cost. They are in profit. But in the yellow slide, you go when we have excluded those costs bear by the Save the Children, and we have then put that cost to the beneficiaries, the return was very different. Now the beneficiaries have to put 45%, like $45 they have to invest to get the $24 per month per beneficiary they have to get. If you remember in the previous slide, like the beneficiaries' most concern was that like this intervention is like in a longer term, this is not a profitable. Even in the previous slide, we have mentioned that those beneficiaries who have started kitchen gardening in 2013, now almost 40% of the beneficiaries have left the kitchen gardening. Only like 59 to 60% they are doing kitchen gardening, and their major concern was that we have triangulated from this one was that kitchen garden on longer term is not a profitable. And here is the economics behind that one, like because they have to spend $45 to get $24 per month per beneficiary cost. Final one, maybe like this was we get this slide like when we calculated total cost in those Excel files, like what was the total cost of the project and divided by the total benefit of the project. When we did that one, interestingly, like it was very amazing for us when we found that basically when we are investing only $1 in kitchen gardening intervention, so it is it is only generating a social value of 0.32, or the social worth or social benefits to the beneficiary, their worth is only $0.32. So, and then we have debated it a lot in our team, and this was a very interesting for us. Yes, in a shorter term, it is giving a benefit to the beneficiaries, but in terms of our economic side, it was suggesting that it is cost kitchen garden are only cost benefit or only profitable when Save the Children is there. When Save the Children is no more there, it will be very difficult for the beneficiary to bear all those costs and get all those benefits. Next slide. Now coming to the limitation of this analysis, as we told you that this analysis was not conducted by any economist. Rather, this was the joint effort from our finance team, our program team, and the meal team. We were just sitting together and we doing that analysis. So we could not do like what was the net present value, like what will be the benefit of the kitchen garden if we can take over for next 5 years, like if the same activity goes, so in the next 5 years what will be the benefit. So that advanced level of the finding that we could not do that one, because we don't have any support of an economist to do that type of further rigorous analysis to calculate what were the discount rates, etc. However, and secondly, if you go to the second point, like in this study, like we were not, there were some benefits to the beneficiary that we cannot monetize, like they are not included into the overall benefits. If we can monetize those benefits, like maybe they can improve our benefit side. For example, there was the women empowerment. Like there was 28% women who are linked to the they were owning produce, and like small majority of the women basically they were owning that income, but we were not able to monetize that empowerment thing. Like that was a challenge for us. So similarly, the biggest, like one of the very important challenge in the limitation was, in the study, the bias factor, because in this data was actually like field data about like field survey that was conducted by the program staff who have implemented the kitchen gardening. So there is a chance of the biasness, like maybe like they have actually implemented this survey, so maybe there is a chance of biasness that they to there should be there could be some chance of higher level of the finding from the fields. Next slide, please.
Thank you, good friend. Can you go to the slide on recommendations? Thanks. So summarizing the recommendations, we've got two sets, one specific to kitchen garden programming and one for a wider FSL, but even other sectoral programming. I think what's important to say is when you look at the traffic light slide that Gufran presented, and it doesn't look particularly favorable, either in terms of the investments for Save the Children or for beneficiaries after the inputs from Save the Children stop being provided. We're not necessarily saying, you know, kitchen garden's no good, it's not worth it. I think what the conclusion for us is that we really need to consider whether it's the most effective approach for food security and nutrition in this context for the outcomes that we want to achieve. I think we're basically saying more scrutiny of the model is necessary, rather than just assuming that households producing their own food is a good, effective and cost-effective way of addressing access to nutritious food. I think we linked to that, realise that we really need to develop a more cost-effective model that works for beneficiaries to continue after the life of the project. We're approaching the end of the programme, and it's quite clear that this intervention in particular wasn't designed with a kind of a very strong exit strategy in mind, and it's time for us to think how we could potentially make that more cost-effective. And linked to that, you know, one idea is about supporting sort of producers or farmers groups that can be linked with government departments, sort of technical support or for collective marketing to bring down some of those costs that they were previously relying on Save the Children to meet. And the fourth point is particularly around this issue of women's empowerment, where the findings were fairly disappointing, that even though it was the women themselves doing the work, when it came to kind of broader engagement in the market or in the household economy or making decisions at household or wider level, that there hadn't really been any progress. And so if we were to have our time again with this program, we'd really look at how we can have a more transformational effect on women and what might need to be done in the broader environment to achieve that. And then the lessons for wider programming, I think, you know, having a look at this sort of value for money approach and these indicators at the start of an intervention would be really helpful. We asked ourselves, you know, what would we have decided had we done this exercise at the beginning based on projections? Would we have gone ahead with the kitchen gardens component, or would it have looked very different? Doing that at the design stage is something that I think would be very, very beneficial to us, and considering both the economic and the social viability, and really developing a strong learning agenda at the onset of projects. So understanding, you know, not just a very output-driven monitoring system, but keeping a focus on what are the outcomes for children that we're trying to achieve, and are those programs and are those specific interventions achieving them. So just before we go to questions and answers, maybe Kate, if you can take us to the very last slide, which is some nice pictures from the project. You know, I just wanted to stress that once again, we're not saying this is an outright dismissal of kitchen gardens. We're not saying we shouldn't, as Save the Children, do them, but that we really need a lot more reflection on their sustainability and on their impact for children. And I think another really important point that comes out of this is reflecting on what we mean as an organisation by evidence. And sometimes we get, you know, quite nervous and feel that evidence is only a very expensive, you know, randomized control trial or external evaluation carried out by expensive consultants. And what the Pakistan team have shown us is that doesn't need to be the case. This was a piece of work carried out by the country offices, MIL and FSL advisors, with a bit of help from member advisors and their own field staff collecting the data. It was low cost and relatively low time intensive, although Gufran might argue with that, but it's certainly an approach that could be used more widely in our programs. And I think we shouldn't be shy of just doing our own reflection and, you know, spending time amongst our own teams of reflecting, and not necessarily always having to have a big, you know, high level study or bringing external people in, sometimes our own knowledge and reflections can be just as powerful, if not more. And then just as a final point, once again, to commend the country office for such an open and self-critical reflection and being prepared to share that sort of internally and externally, and really, question our design decisions and learn from our work. I think it's a fantastic example to all of us. So I think we're going to open up to some questions. Kate, since I've got limited visibility, would you mind sharing that?
Of course, yeah. So if do you want me to take control of, I'll take control of the questions in the box, and then I'll also just invite people, if you want to unmute to ask your question, that's fine too. So the first, there's one question in here. There was a couple of questions up here. Let me go back to the beginning of them. So there's one here. Has any sensitivity analysis been done with respect to the red scenario on one of the slides? So if I take us back to the red scenario.
Yeah, as I mentioned earlier, like we did not do that sensitivity analysis or dead weight or attribution and drop effects. We could not do that one. Like what we did actually, what we have calculated the total cost of the project, that like which were happening in the kitchen gardening, and what were the benefit, and simply we have calculated that one. If we have an economist with us, like we can do it.
Can I add something to this question? This is Grazia. I wrote this question. Yeah. Thank you so much. This is Grazia Pacillo from IAE team. I'm the Senior Impact and Evidence Advisor here. We work a lot on value for money in PPQ in Save the Children UK. First of all, I would like to congratulate you with this amazing work. I mean, it's the first that I've seen in the entire Save the Children that actually a meal team has taken on board, and it is amazing. To the extent that you have mentioned before, the limitation that you had, and on top of all the other things that you're doing for the program, so it is. I'm really happy to see this. At the same time, I'm a little bit confused about the three scenarios, and especially with regards to the red one. So, would you interpret the red scenario as the project now having value for money, and what do you mean by the cost? If the costs were translated into the beneficiaries' side, what type of cost is Save the Children bearing? Like apart from the training, this is another question that I put in. So is it only the training? I might have missed something in the beginning, but do we really, if it's only the training, do we really think that these costs are gonna be phased and bed in the regularly, or is the children providing inputs and stuff like that? And then the other question is about yes, the length of the time that has been considered, because it might be that some of the health outcomes or women empowerment, for example, they can be on the long run. You can see the effect on the long run. So we will be interested in see how long you've put down the kind of line of accountability. Where did you stop in estimating the net present value of the benefit and costs? But anyway, overall, well done. It's amazing.
Yeah, thank you so much. Like these all are very important questions. Like if like your assumption, like from red slide, like this is very clear. Like this is not a good value for money example. For example, if we are investing $1, it is not giving us a full return of $1 in return to that one. Though there is even we did not came across any value for money standard where we can compare that what is the best scenario that we can spend $1, so what could be the possible return. So we don't have any that standard, but even looking at this picture, that if we are spending $1 and the return is only $0.32, considering the limitation that we have told over there, that we could not monetize some of the benefits, even that scenario is not good example of value for money, even for our Pakistan team that we have thought in the longer term. As you mentioned, like if you look at those two scenarios, in the first scenario was that we calculated at present time, like we have calculated this is a scenario at present time. For example, the benefit they have get from this training at this time was because the input they are using right now, these are those inputs and the other thing which have been supplied by Save the Children. Secondly, at this time we are doing a strong follow-up with them. We are going over there, even the agriculture extension department with the homework, they are doing a follow-up with them at this point. We are bearing all those costs. And thirdly, like the training we are providing to the beneficiaries right now, like for example, what if they have to get that training from some outside? They have to get that training on their own. They have to bear that cost. Actually, and so we were right now, like all that training cost is bear by Save the Children. So we included this as a cost that Save the Children is bearing, and the second, even in this one, we have calculated what is the other cost that beneficiaries are bearing. Like that is the cost, like their opportunity cost in terms of their household work, and the cost when they are selling those things to market. So calculating these costs, we found like if we spend like $14, like there will be a total benefit of $24. Like when Save the Children is actually bearing that cost. So what if in yellow slide we are saying that what, like in the for example in the next season, or in the next time, like there will be no Save the Children. Like one of the limitation we have found through a study, that was the follow-up from the government department. Like that is there when from the previous where we were working in the previous areas, like those follow-up now when we are phasing out, that follow-up is less from the government side. And secondly, that rigorous follow-up that we are currently doing right now, like our team, our agriculture other team, they are supporting them, they are guiding them. Like in the future, like that support might not be there. So the cost of the inputs, so the cost of the inputs they have to bear by themselves. So when we included that cost to the beneficiary side, like what if they have to bear that own cost in the future when there will be no more Save the Children? Like the benefit will remain, like most probably this benefit will we have found that it will remain, most probably they will remain same, like there will be a $24, because if you look at the previous slide, like people are already complaining, like it is on a longer time, it is not generating that much profit to us. So on the longer period of time, like those benefit, our assumption is like maybe they would be less, but this time we have like they will remain same. In that scenario, they have to spend more on the cost side, and the benefit will remain same. So that's why in the qualitative study, like we found like beneficiaries are leaving this independent. And another point that you have mentioned about the length of the time. Yeah, you are right. Maybe their health intervention, like maybe like their improved health status, like we have calculated that cost, that their health basically. We did not have any informatical measures about the nutritional status of the children, like how their nutrition status have been improved. But we've done a cost of diet modeling in the initial stage of the project. In that time, we calculated that what might be the possible benefit. And secondly, in the initial survey, we found that what are the health expenses that these women are doing at that time. So our proxy indicator was that because of now the kitchen gardening has improved their nutrition and health status, so ultimately their expenses and health will be reduced. So then we have monetized those health saving into the saving, because what they are having from that health side. So now, right now they are the benefits. So maybe when we can compare over the period of 5 years, like maybe they can retain for 1 year or 2 years. But looking at the factor that sustainability is getting lesser, so that might not longer for the longer period of time.
Thanks, Gufran. And I think Farouk has a question, just a clarification question on the meaning of the red slide on the slide that we're currently looking at, the returns on investment, around what is the calculation behind the third measure that is returns to Save the Children.
Yeah, in that one, in third one, like we have returned to Save the Children, like we have calculated that what, like the total, the cost we have calculated in this one, that is actually all that training cost that the children are paying into that one. That training cost means that we are paying to beneficiaries, we are paying to those training consultant, and then the inputs we are providing to the beneficiaries. Even in that, interestingly, you will like in this, we still did not include that cost of the cost we have not included in that one. If you include that cost, so might be that 0.32% will reduce. So in this, we have included the training cost, input cost, And another, there was another, we have included those forecasts, and then we monetize the benefit as we said earlier slide, like about the saving, about the income, and those, and we get their monetary value, and then we divide that monetary value with the total cost, and then this was the answer, that 1 is equal 1 ratio 0.32.
Thank you. And then to go back up to another question, so there's a question here, relative to the baseline, what was the change in the women's empowerment indicators as a result of the intervention? For example, the percentage of women making expenditure decisions for the household.
Yeah, this is really very important question. You know, we have debated a lot when we were when we were doing this analysis. You know, for women economic empowerment, those organizations who are really working on the women economic, like there are the 3 main indicators. One is the control over their income. Second is like their linkages with the financial inclusion, a financial institution, and third is their participation in the household level decision making. When we go with this lens to know that basically how this intervention has empowered women, so we found that as far as the ownership of the produce was concerned, like they were empowered, like they have the ownership of the produce. But when it's come to the selling that product into the market, there was a very less, only like 28%, like they were selling that product in the, like majority of the women, they were not selling. So they have to ask someone else, usually that is a male household member, who is going to sell that in the market. So in the return, we found that there are only small amount of the women, you know, there are like 70 to 80% they are owning their produce, but when it's come to retain their income, like that was very less. So honestly, if I would say that in terms of economic empowerment, for me, like there was no economic empowerment. Like, yes, that was the added burden on them. They have worked on that one, but finally they don't have that control of income in their hand. Again, that went in the hand of the male family.
Excellent. And then I think, Ros, you said you had a question, so if you'd like to unmute and ask the question.
Sure. Hi everyone. Thanks so much. I love this. I've heard about it over the years, so it's brilliant to see. It's brilliant to see it in just so much colour, and to see how many pros and cons there are to it. In Save Denmark, we've been working over the last few years in northern Ethiopia and now in South Sudan on something very similar, but not as well documented or detailed as this. But one of the key things now is trying to do this in a conflict setting, especially in one of the refugee camps in Maban in South Sudan. Yeah, it's been challenging, but I was really interested to hear what you've said about women. But what about children and their role?
Yeah, in the one of the study part was that we have found like there was certain families who were like women who were sending their children to send that to sell that in the market. That was a certain percentage. That was not much higher. And then we have also asked a question about that either like your children, are you involving them? Like we were thinking that might be possible that has also added a burden on the children side. But that involvement of children was there in managing kitchen garden, but it was not that much significant.
Okay, so they were kind of part of it, but not maybe leading it.
Yeah.
Okay, because what we've tried at the moment for the last 4 years is to have the children kind of leading the process. So that, yeah, it's kind of on a slightly different angle and probably not as widespread.
Can you a bit explain like how children are leading that process?
Sure, yeah. So they looked into what types of fruit or vegetables that could grow there. So they had little they tried different things, and they set up and designed a mini irrigation system.
Excellent.
And then their families used to come and see, and so then they wanted to do it by their households. So the children were able to work with their families on how they could do it at home. So it kind of spread like that. And there was one particular village which was so passionate about apples. They'd never really seen them up before, but their conditions for growing apples could grow really well. So it's become an apple village. Yeah, so different ones, different things have grown according to the different environments there. But it was so exciting to see children really kind of passionate about it, and you know, so enthusiastic about carrots and papayas, and just the difference it made on what they were able to eat as well. So it used to be a school feeding program, and so it was brilliant to be able to transfer it into the school gardens. Yeah, so that's how that worked.
Yeah, thank you. Thank you, Ira. It's good to know that how you are involving children. Like this is excellent. One point of like Grazia has, and if we look at the left corner, like Grazia has raised some very important points. I think one of the Grazia comment was that actually it depend upon the selection of the proxy indicator. I think this is very true. Like the best way, like what we learned over here is that whenever, for example, the best way is to find out about the proxy indicator. That is a challenging, but that's not difficult. So best is like, for example, when we sit with a project team and we ask them, the first step we have mentioned in this study was stakeholder analysis, and found that first step is to identify like what are the key outcomes that we will get from this project. Might be possible in the log frame there might be only one single indicator about the kitchen gardening. But when you talk to the even before going to that data collection thing, you talk to the beneficiary, you talk to the project side, and best is, for example, if you want to plan any CBA study in your area, first thing is that you just sit with the stakeholder, and then you find like these are 1, 2, 3, or 4 stakeholders. So what will be the key outcome for each stakeholders? And then you just try to think that in these outcomes, what will be the key outcome that we can monetize, and what will be the possible indicators, proxy indicators. I think when you will be discussing that with the project team, I think solution will come over there. It is not that difficult if you really spend some time before going into the data collection. But yes, that is very important, because that will actually make and shape all your return on investment scenario. And I tell you one important thing, like if we have basically the guiding document that we have used for this study was the social return on investment guide, which was there available on internet. If you look, that is mostly like other organization, like in Pakistan, I am aware about Care International. They are doing cost benefit analysis, but when they did cost benefit analysis, they found like there are the social benefit which we cannot monetize. Then they have converted toward this social return on investment side. So I think this social return on investment methodology is basically very important. That can help us, and it is very easy to follow.
Excellent, thanks, Kifran. So we've got 5 minutes left. There's a couple of questions, and then we'll see if there's time at the end for another couple. But there's one question from Gengalang about the problem of water in the intervention area, and whether this could affect the whole effort and therefore the outcomes.
Yeah. Please see it. I did not know where it was. Can you repeat it?
Sorry. So it's the question about the problem of water in the intervention area, and whether the lack of or excess of water would affect the whole effort and the outcomes.
Yeah, Shahid Sahab, can you explain? Like we were discussing some time about the availability of water in the area and how it was affecting to the kitchen gardening.
Yes, I've already responded to this question. This area is already water scarce, and climatically it falls in a very hot zone. I mean, the mean average temperature is very high in these areas, so ultimately the water availability, especially for farming, may be a problem for most of the area. The safe drinking water supply is also an issue in overall in rural districts. So yes, of course, the availability of water in these extreme weather conditions may affect the outcomes of this activity, affecting, of course, the yield and the rest of the activities involved in this kitchen gardening. So I would say yes, the water availability can affect the outcomes of this activity in the intervention area.
Excellent. So there are a couple of questions on next steps and around sustainability. So if I kind of squish them into one question. So Grazia was asking, what are the next steps for this study? And was kind of touching on whether you would look to have it peer reviewed, because I think that would be useful. And then there's also a question from Diane around the sustainability and scalability of this program. And looking at what happens with our other interventions when they end, and whether those activities can be continued.
Yeah, Vanessa, can you respond to this?
I'm having a bit of trouble with sound. Can you repeat the question, please?
Of course. So it's kind of two questions squished into one. It's around next steps for the study and whether you would look to have it peer reviewed, but also around the sustainability and scalability of the programme and whether the activities could continue.
Yes, on the next steps of the study, to be very honest, the initial purpose was very much internal because, as I said at the beginning, the Pakistan Country Office has a very long history of doing kitchen gardens, and we've been a bit guilty of just kind of doing what we're very, very good at doing at scale. And so the prime purpose was for us to stop and reflect and think, well, what does this mean for our future programming? So having done that and learned very well from that, I think we do need to think about what's next for the study, and what resources and time there is to invest in perhaps getting that peer reviewed or sharing it more informally externally. The sustainability issue is a really big one that came out for us. I think certainly looking at the links between beneficiaries and accessing government services themselves for technical support, but I think we could also have done more on the market strengthening side. I think making sure that beneficiaries, and particularly women, are linked to market actors. They have the knowledge, the confidence to access quality inputs at a decent price. They know how to do that. They have the skills and the confidence, and they're able to market their own produce in order to get the best price possible. I wouldn't say that the project has fully achieved that, although there has been some steps before that towards that. So we're wrapping up the program now, so we're not going to be able to really drastically change the model for these beneficiaries, but there's certainly a chance for us to reflect on what can we kind of salvage and take forward for those who have invested so much for now, and certainly what can we learn going forward. Shahid, I don't know if you want to add anything on the sustainability side.
Vanessa, may I add something?
Please.
Vanessa, we have also a similar activity under another project in District Sagar. That is another BMC project. We have also conducted, the meal section has conducted the research study for the kitchen activity there, kitchen gardening activity there. I just reviewed the report showing fantastic findings as far as yield and other benefits are concerned, but we can repeat this cost benefit analysis for that study as well to validate our findings for the current study which we are discussing right now, and maybe we may be able to find some valuable things from their study as well. I mean, focusing some other dimensions as well, which we have discussed during this webinar as well. So we might be able to come up with some refined findings for our next study as well. Ghufran, your thoughts on this, please?
Yeah, I think that you both have already covered all those things related to sustainability. But I would, at the end, I would like to make one point from my side. Like, whatever we are doing for the interest of children and for to address our key breakthroughs. But I think either they are benefiting, they are generating social return. But I think one big question to us is either we are doing value for money, like either what we are doing, so how much is basically returning in that one. So in the future, when there will be a very squeezed funding and there is a competition all enough in this sector, so I think we really need to invest on this side. So we should have come with some other studies. Like this was a very internal analysis that we did with our limited skills in Pakistan, and we have reflected to our program teams like this is good, but these are the limitations. So I think these type of analysis that we can do while that data is already available. Like we don't need to do that expensive, but we can make this as part of our ongoing analysis. And if organizations want, we can do some sophisticated SROI study or cost benefit analysis study for the entire project if the funding is available. Basically, that will actually show us a picture that either it is a good value for money case or not. And secondly, another important point that I would like to make is like, we have covered this thing because it was only because of the availability of the learning agenda that we have developed with the help of SC UK. If we have not developed that one, so it might be possible if we have hired any consultant to do that kitchen gardening thing, like he would have only come with the kitchen gardening thing. But this was the part of the learning agenda, and there was the project team. We know about all those connections, and we did this as part of that one. So it is very important that team should also develop their learning agenda in advance of the project. That will really help them to have some targeted learning. Otherwise, very important aspect of the program will be missed, because learning of everything means learning of nothing. So if we have that targeted learning approach, learning agenda is available, and we are focusing them with this approach, I think then we can put us some very good research and evidence about our impact.
Thanks, Gufran. So before I hand over to Vanessa to wrap up, because we are just slightly over time, I just wanted to make 2 points. Firstly, to thank the Pakistan team and their for sharing today and for carrying out the study, but also to say that I've recorded the webinar, so I will make that and the report and the presentation available hopefully by the end of today, and I'll share it with everybody on this call and all the participants who accepted but weren't able to join. But can I also ask that you try to share that with other colleagues as well if you found this interesting, because I think as you can see from the chat box, everybody's pretty much unanimously coming back with very, very positive feedback. So I'd like to share this as far and wide as we can. So, but thank you very, very much, and I'll pass over Vanessa to finish off.
Thank you, Kate. Just to say a huge thank you to everyone for participating so actively and for all the questions. Sort of hearing everyone's questions, thinking we should have had this discussion when we started the study, because there are some really great ideas that we could have included. And just to say thank you once again to the initiative from and the openness from our colleagues in Pakistan. Kate is going to share the report, and it has all 3 of our email addresses. So if you do think that this is something that you'd like to replicate in another country office, or you just want to know more, I think we'd all be very happy to discuss and share our experience and work with you. So please don't hesitate to get in touch. And thank you very much to Kate and the Child Poverty team for organising the webinar.